Parts of Mamelodi Regional Hospital have been given a revamp, this in the hope of providing better services to residents. The Gauteng government says this should be a model for all other hospitals in the province. There's been much criticism about the state of hospitals, worsened by water and power cuts. eNCA's Heidi Giokos was at the hospital and tells us more.
Gauteng Premier Panyaza Lesufi emphasizes the importance of improving services, especially in townships and informal settlements. He says they should never be neglected, and this newly revamped Mamelodi Regional Hospital is a good example and start of what hospitals and services should be like.
It hurts me that when I leave here, someone tomorrow will go to our facilities and they will never get help. It hurts me that someone tonight in our hospital, they might not even get supper because we didn't deliver food to them. And I want to say to the leadership of the hospitals, you have seen the Jerusalem. Let's create all this Jerusalem in all the areas. And my instruction is simple. You start in the townships, informal settlement, and hostels. Other people, where our people are, we're in the townships. And I don't hate any other person, good people. But our people have been suffering for too long.
Health Minister Dr. Joe Phaahla says this hospital is an example of what can be done without an exorbitant budget. He says oftentimes government is being ripped off. Revamps and upgrades here at this hospital cost 9.5 million rand.
It can't be right that government spends so much and gets so little. Infrastructure is just the worst in terms of how much government spends and gets so little returns with poor quality. So just just this morning, I think, Mr. Tagala, if you didn't believe what I've always been saying, that we must stop this. We must stop this, kind of, almost fruitless expenditure, in the sense that we're being exploited, in that we spend billions and millions and with very poor outcomes. We're being ripped off.
Water restrictions and constant power cuts have had a huge impact on hospitals across the country. But both the Premier and Health Minister say this is under control.
I had a long session with the senior leadership of the department. I must say it was a heart-to-heart. When we left there, all of us accepted that we have a huge challenge. And I'm saddened when you quote doctors say they might get sick or they're getting sick. You can imagine patients, and you can imagine people that are even scared to come to our hospitals, because the major part is not people that are within hospitals. There are those that are scared because they think our hospitals are not fit to assist them. So with the team and what we've just resolved this morning, I remain hopeful.
The newly elected MEC for Health in the province says they're working hard to sort out healthcare in the province, given the myriad of challenges. She says all she needs is 30 days to get the ball rolling. Heidi Giokos in Mamelodi.